I just was talking to Kathy Luch over here because in 1994 and a little earlier, for about 7 years before that, there was an agency in Port Angeles that came down to Port Townsend one evening a week, right? And provided family planning services to the Jefferson County. And that was our only family planning services back in 1994 and earlier. So in 1994, Public Health identified a community-wide need for family planning services and services for adolescents. Because of the community need, Jean Baldwin, I was kind of hoping she was going to be here today, Community Health Director for Jefferson County Public Health, decided to apply to be a federal Title X family planning provider through Washington State Department of Health. Thank you, Jean. Those are not easy applications to write, as we all know, the people at Public Health know. Jefferson County Public Health got the grant and started providing full-scope family planning services in 1995. By the late 90s, Jefferson County Public Health was seeing about 600 women a year for family planning services. An important result of becoming a federal Title X family planning provider is that Jefferson County Public Health is able to dispense birth control methods, pills, patches, and rings at the time of service, so clients don't have to make a trip to the pharmacy to pick up their prescriptions. Also, Jefferson County Public Health Family Planning was able to incorporate sexually transmitted disease testing as part of the services. Lisa McKenzie just showed me earlier today that in 2016, Jefferson County Family Planning Program diagnosed and treated over half the sexually transmitted disease reported in our county. So then, in 1999, Washington State applied to the federal government Medicaid program to do a pregnancy prevention project to reduce the cost of unplanned pregnancies. The project included providing family planning services for low-income women and men at no charge. The program was called TakeCharge. Since Jefferson County Public Health was already a federal Title X family planning provider, Jefferson County Public Health was also able to become a TakeCharge provider. Jefferson County Public Health was now able to build Washington State Medicaid program for providing family planning services to clients who qualified for TakeCharge. By the early 2000s, Jefferson County Public Health was seeing over 1,200 clients a year, both women and men. TakeCharge also paid for vasectomies. Jefferson County also started billing private insurance and employer-based health insurance. Any woman could come to public health for the reproductive care. Then, in 2008, thanks to Jean Baldwin again, Susan O'Brien, Yuko Ameda, Port Townsend and Chimicum School Districts, and Jefferson Healthcare, thank you very much, Jefferson County Public Health was able to start school-based health clinics at Port Townsend and Chimicum High Schools. This was a lot of work. But by creating school-based health clinics as satellites of Jefferson County Public Health Family Planning Program, it also allowed the school-based health centers' nurse practitioners, like Susan, to be able to dispense birth control methods at the time of visit. This is a great resource in a rural community where getting to the pharmacy to pick up prescriptions can be a challenge to anyone. If you want the full report, we do annual reports on the school-based health clinic, and I can get those reports to you, and they're on our website if you'd like to have more details about numbers of people that they see. School-based health clinics are rare, especially in the rural communities. According to Washington's School-Based Health Alliance, there are only 8 school-based health clinics outside of the Seattle area, and of those, 2 of them are in Jefferson County, Chimicum High School and Port Townsend High School. Woo-hoo! Yay, Jefferson County. So then, in 2013, the Affordable Care Act increased access to free and low-cost health insurance to low-income adults. Yay! This was called Medicaid Expansion. Jefferson County went from around 3,500 adults and mostly kids on medical assistance to over 7,000. The actual number is 7,828, because I went to the Healthcare Authority's website and looked it up. Those people on medical assistance, in Washington State, medical assistance is called Apple Health. So at that point, most of the clients that Jefferson County Public Health saw through the TakeCharge program were now able to get on Apple Health. Medicaid Expansion is wonderful for low-income individuals who could not afford health insurance in the past. Now they could go to any medical provider who takes Apple Health insurance, and they can get full-scope medical care, including family planning. The Affordable Care Act also required that all insurance plans cover essential benefits, which includes preventative services, such as family planning with no deductible or copays. Yay! So where are we today? The great news is Jefferson County has one of the lowest teen pregnancy rates in Washington State. Yay! So this is probably due to all the work that's been done over the past 20 years to ensure adolescents and low-income women have had access to reproductive care. Now the challenges. The first challenge is funding. The cost to provide family planning and school-based health clinics has gone up, and revenue has gone down. And revenue may go down more depending on what happens at the state and federal level. The federal Title X grant that was to start April 1st hasn't been allocated yet. Washington State is providing state funds to cover the contract starting April 1st, anticipating the federal funds will come. We'll see. Washington State budget process is going on in the state legislature in Olympia at this moment. There is a chance that state funds for family planning could be cut as early as July 2017. If the Affordable Care Act is changed and Medicaid expansion is eliminated, thousands of Jefferson County residents will not have health insurance. So, the next challenge is priorities. The good news is Jefferson County has a low teen pregnancy rate. The bad news is because we have a low teen pregnancy rate, providing family planning services is not a priority in our regional and our county health planning process. The past few years, Jefferson County Public Health, Jefferson Healthcare, and community partners have worked on a community health improvement plan. Preventing unintended pregnancies wasn't one of the priority issues to work on since we have a low teen pregnancy rate. Yes, there are many pressing healthcare needs, like access to dental care, mental health treatment, and drug and alcohol treatment. But since providing family planning services wasn't listed as a priority, the programs and fundings are at risk. Also, Jefferson County is part of a 3-county, Kitsap, Clallam, and Jefferson, regional accountable community of health that is part of the Affordable Care Act. The accountable communities of health worked on ways to make the healthcare system more efficient and identify areas to work on to improve our health. Our regional ACH is called Olympic Community of Health. The Olympic Community of Health looked at the Community Health Improvement Plan for the 3 counties and other data. And again, preventing unintended pregnancies wasn't identified as a priority at this time because the data shows that we have a low teen pregnancy rate. So, I'm concerned that if family planning and school-based health clinics are not a priority and there isn't funds to cover the costs, they could be eliminated. In the past 10 years, most public health departments have quit providing family planning services. Other agencies like Planned Parenthood and federally qualified community health clinics have been willing to take programs and absorb the clients, but Jefferson County doesn't have a Planned Parenthood or a federally qualified community clinic. The closest Planned Parenthood clinics are in Port Angeles or Bremerton. Okay, so what community action would be helpful? If you want to support local family planning and school-based health clinic services, first advocate for those services with the local county commissioners and county administration and Jefferson Healthcare. You can thank them for being supportive of family planning and school-based health clinics the past 20 years, but there's always competition for public funds for needed programs. If family planning is not seen as a priority, it could be cut. If you want to financially support local family planning services, you can donate funds to Jefferson County Public Health and specify what you want it to go to, like school-based clinics or family planning. If you want your donations to be tax deductible, you can make your donations through United Good Neighbor and specify Jefferson County Public Health, school-based health clinics, or family planning. Veronica Shaw, thank you very much for being here. Jefferson County Public Health Deputy Director and Chief Financial Officer will make sure those funds go toward the services you specify. Thank you, Veronica. So what can be done statewide and nationally? You can advocate for continued state funding for family planning services. Washington state legislators need to know that family planning services are important. The research has shown that preventing unintended pregnancies saves money. And it's not just medical costs for prenatal care, delivery, and infant care, but social and emotional costs on families and individuals. Preventing unintended pregnancies decreases the risk of children experiencing adverse childhood experiences. We call them ACEs. Children who experience ACEs have a greater risk of problem behavior in schools, greater risk of drug and alcohol abuse, greater risk of mental health issues, and greater risk of chronic disease such as diabetes and heart disease. If you want more information on ACEs, let me know. We got lots of research on ACEs, the consequences of adverse childhood experiences. Nationally, you can advocate for continuation of the federal Title X Family Planning Program, Women's Health Care, and the Affordable Care Act. I appreciate the state and national Planned Parenthood legislative advocates, and they and other women's advocates are working day and night to keep the public aware of legislative activities and actions that threaten women's health care. And I'm not sure what the future holds. My personal passion is that young women have the support, resources, and education to make healthy choices. It is up to all of us to be their advocates. I'm thankful I live and work in a community that supports women and girls, and thank you.